Thank you. As mentioned, my name is Patrik Stavsed and I'm the CEO of Omnio. That's a spin out of Umeå University up in northern Sweden. And I'm going to be a bit of a contrarian today because you listened to Cirino's Scientific and you heard how important it is with anti-inflammatory properties, as well as Aptaham, who tells you what happens when an inflammation goes haywire into a sepsis. And I'm going to talk about pro-inflammatory drug development because that's where we're a pioneer. You all know that inflammation is the way that the body responds to trauma or to injuries, as we call it. It could be an infection with bacteria, it could be a trauma where you hit yourself on the thumb, or it could be just an incision wound. And all these responses will generate inflammation. And it will be heat, it will be redness, swelling, and that's because the inflammation is going a little bit too far. And that's when you get pain and you get fever, and you need to reduce that with anti-inflammatory drugs. And those are the most common ones that we have. We have aspirin, acetaminophen, diclofenac, and naproxen. But where do the pro-inflammatory drugs come in? What do we do if the body just doesn't respond as it should, if it doesn't give you the inflammation? There is a professor up in Umeå University who has been working with plasminogen for 30 years. He is Professor Tourny. He founded the company, and he discovered that the protein plasminogen actually regulates wound healing in all of its different phases. Because when it goes to wound healing, it's three phases. It's first an inflammatory phase, then it's a proliferation phase, and a remodeling phase. And this protein plasminogen is quickly concentrated where the area of the injury happens. So plasminogen is a protease that is produced in the liver, so you have it in all your bodily fluids on a low concentration. But when it's needed, it's rapidly concentrated to the area of the injury. But what happens is that plasminogen is a key regulatory molecule, so it takes care of all the time span that's needed from the initial injury until the wound is entirely healed. So the injury will activate the plasminogen receptors on the surface of the cells. Plasminogen binds there and it's activated by TPA or UPA, and then it leads to a lot of different processes in the body. It regulates gene expression. Some are upregulated, some are downregulated. It removes bacteria, it removes necrotic tissue, and it can help heal several different indications. So what we have been working on is wound healing as the #1, both for the worst ones you can think about, diabetic foot ulcers, but also chronic perforations on the tympanic membrane. But it's also other types of wound healing that you don't consider wounds immediately, like periodontitis. And it can also help against infections, help the host defense system. So, plasminogen, it can actually stimulate wound healing where there has been a stalled chronic wound. So these pictures aren't nice, but there are patients out there for where the amputation is the only other alternative, and they are willing to test things. And here we have a patient that had a chronic wound for 3 years that he couldn't walk on. But after treatment with plasminogen, it took about 3 weeks with injections every 2 days. And as you can see in the middle picture here, the wounds are healed and you can start walking on your feet again. So this creates a tremendous benefit for the patients suffering from this. The alternatives that we mentioned for diabetic wounds is often amputations of lower limbs. And these amputation wounds tend to have a bad healing as well. But here we can inject locally plasminogen around the injury, and it will stimulate the body's own mechanism to heal the wounds. So what's good is that we're having a biological feature that then shows no side effects because it's already in the body. We're just concentrating it to the spot on the body where it makes most benefits. And of course, these diabetic wounds, they cause a huge financial burden because of the 300 million diabetic patients, about 10 to 20% of them will actually develop diabetic wounds. And there are millions of amputations ongoing in the developed world every year that could be avoided with a simple biological product. I also mentioned chronic tympanic membrane perforations. Today, the alternative is that you actually cut open your outer ear and you flap it forward so that the surgeons can access your ear canal and put in a little thin paper, which they hope will integrate with the membrane that's perforated. With the plasminogen injections locally, we can stimulate the tympanic membrane to heal by itself. Then, as I mentioned, periodontitis is not what you really think about as a wound healing, but we see the same process there. And periodontitis, that's a very common disease. We're talking about 700 million people in the world having severe periodontitis that will lead to tooth loss. And you all know that gingivitis is very common. And that is one stage of the disease, but it's not dangerous because it doesn't cause the bone around the tooth to break down. But if you're looking at the periodontitis on the right hand, you can see that there are gum tissues falling apart from the tooth, and there is a deep gum pocket, and the bone will actually start to break down, which leads to tooth loss. But when we treat mice, it might be hard to see here, but when you have the tooth here on both sides, you have healthy gum tissue, and you have an alveolar bone in between that's healthy on a healthy mouse. When you're looking at mice that don't have any plasminogen, the bone will break down and the gum will be very distorted. But when we give them plasminogen, not only can we stop the periodontitis, we see that the alveolar bone actually regrows. And that's what you see over here. And that's what makes dentists enthusiastic when we talk to them. They said, wow, can you actually regrow bone so we have something to put the dental implants in if we need to restore that? And can you stop the tooth loss? If this is transferable from animal to humans, that's something that's going to revolutionize the dental implant world. We have also shown that plasminogen can actually treat bacterial infections. So we have shown that in mice where we have infections with MRSA in the knee joints, we can actually lower the bacterial count when we treat it with plasminogen. And the same with E. coli that we've just done recently. We can show that 12 days into the treatment, we can reduce the bacterial count with 100-fold. And if we can solve this, then of course, the benefit is that there is no antibiotic-resistant development because we're helping the host defense system of the body to be engaged instead of killing the bacteria. So we have patents for all of these 4 indications that I mentioned: the chronic wounds, the tympanic membrane, the host defense against infection, and the healing of periodontitis and periimplantitis. And we also have an ongoing patent file for reducing the side effects from radiotherapy, which is a different subject I can talk to you later about. But so far, the first 2 indications are out-licensed. There is a phase 1 that is currently paused at the Karolinska, where they're trying to do tympanic membranes. We have an approval from the MPA to start the diabetic foot ulcer treatment here in Malmö and Lund. And now we are focusing at Omnio on the preclinical development of the other 2 indications that we have. So if you want to join us on this journey, I'm very happy to take questions after the break.